Hello everybody, my name is Carlos Petta. I am from Brazil and a board member of ISGE. At this time we are here in São Paulo, where we are having our joint meeting with ISGE and the Brazilian Society of Endometriosis. One of the themes that is very concerned for everybody and our whole population is endometriosis in adolescents. This is a growing problem, and we have here now Dr. Vivian Amaral. She works in Brazil, in the south of Brazil, in the city of Curitiba. And Dr. Vivian, how do you see endometriosis in adolescents? Is it a real problem? The symptoms are starting early in the life of a woman. How do you feel this problem?
Well, hello. We have about 6 million women with endometriosis in Brazil, without saying that they are adolescents. But one important thing is prevention. Nobody focus the dysmenorrhea since early at menarche, so we should make some prevention with them. Take care of the symptoms, early symptoms, and give them some suggestions of changing her lifestyles and start looking for the disease.
What's your impression and data on diagnosis delay on this population?
You know, they take about 5 to 7 years to have the diagnosis. And adolescents, we believe we have 60 to 50% of girls having endometriosis, but if they take 7 to 12 years to make the diagnosis, so when they found out, they have not early stage, but deep disease.
What would you advise for those youngers that have a relative with endometriosis and have some symptoms?
They should go to gynecologists and say what they feel. They should change their lifestyles, like having nutrition, adequate nutrition. It's so hard to do it for adolescents, but they should do exercise are important, and if they have symptoms, they should be investigated.
Any special type of exercise, dieting, do you think it's important?
Aerobics is very important for endorphins, for pelvic pain. Physiologically they work, and they should alternate, depends on the age. Today we have certain exercise for a specific area and for a specific age, earlier and later, like basketball for the young ones, or even swimming and all this stuff.
And do you think, what about a laparoscopy in this woman? Is it the first choice? Do you think the first choice is using oral contraceptive or non-steroid anti-inflammatory drugs? Based on what? On imaging? How do you decide what to do with this women?
Depends on the symptom, your clinical exam, your ultrasound and exams, laboratory exams. If you don't find anything, you should make at least a therapeutic test for 3 to 6 months. It could be with oral contraceptive. If it doesn't get better when you suspend it, you should think about endometriosis. Or if you get some marker like CA-125 in an ultrasound suggesting endometrioma or any type of deep endometriosis, we should plan before the therapeutic stuff. We should take it to the surgery and whatever.
How does it relate to emotional symptoms?
They're very important because can you imagine a woman 5 to 12 years every single month with a pain, a pelvic pain, 5 to 7 days each month? Can you imagine that? The family cannot support them, so they cannot work. It might be hard. So depressive symptoms start to appear because everybody else around her looks at her like she's something strange, because every single time she's got something different.
And in fact, what we see is that endometriosis occurs in adolescence. So it's very important to think about this diagnosis, to be careful with these young women. We can prevent severe cases in the future. We can change their lifestyle and their life quality, and probably to improve their quality of life and the control and treatment of a possible disease. I would like to thank Dr. Vivian Amaral from Brazil, and we hope you continue your research and good quality research taking care of adolescents in your country. Thank you.
Thank you. Bye-bye.